topic of the discussion, and let's see and have a common understanding of what primary health care means. To me, it's actually the foundational pillar for our universal health coverage that is contained in SDG 3. And not only that, it's actually the foundational pillar for health development in general. Because it's not just about your health interventions, etc. It goes beyond that. It goes beyond other social determinants of health that are very key and important to delivering the health interventions. And if you go back to your definition of primary health care, you will discover that I have isolated 5 key principles which are still very relevant to us today. And all the 8 elements that were contained therein is what we're still struggling to deliver as an essential basic package that every person should have. And I know at one of those global international seminars, we even thought that we should make this one a human right issue. Behold, I think if you have this understanding of primary health care, then you begin to see that with these principles, with these elements that we have defined, there's nothing in the universal health coverage that will not be able to achieve, because underlying universal health coverage is quality services, health services anyway, which can only be delivered when you use these principles and strategies. Let me emphasize one point here, and the point I needed to emphasize here is that quite often when we talk about the social determinants, we forget the important role peace and security can play. Those of us that are in Nigeria are living witnesses to what conflicts can do. With all the huge investments, if you put it in and you don't address that aspect. So this is the understanding of primary health care that I want us to have to be able to deliver universal health coverage. Universal health coverage concept to me is basically 3 things. Quality health services for everyone, and it says at all ages, isn't it? For all, at all. That's what but it's about quality health services. Underlining quality health services, you must have the right drugs, the medicines, what have you. They must be of good quality. They can't be fake. And you say you'll be able to deliver quality health services. I think there's supply chain in that for you, for us to think. But then, other than just quality health services, in terms of just its full range and high impact, it's about these services that will be equitably distributed among the population, especially when you view the fact that 25% of wealth inequality, and then about the financial protection it provides to at least buffer you from facing any hardship, financial hardship that can actually throw you off balance